And there we go. I think we're live. Hey. Hey, welcome everybody. I'm Dr. Jerry Cartsinell. I'm board certified pediatrician. It's another Wednesday. It's another COVID-19 day. Who's getting tired of being a homeschooling teacher? Oh my goodness, I keep talking to families out there day in, day out. This is exhausting. This really is. Even more exhausting if you've had mold exposure. So we're going to be talking about mold today. Mold is not anything that I'm unfamiliar with living here in Florida. We have just anything can grow mold. If you live in Arizona or in Nevada, you're going to have a lot less mold. Mold loves humidity. Mold loves wetness to grow. So mold issues, parallel so many other things that we get exposed to. So there's a lot of symptom overlap. So we're going to talk about the symptoms of mold, and there's a lot of symptom overlap because the human being has only so many ways to express that it's not doing well. Chronic fatigue, mental fogginess, pains, fibromyalgia. These are all symptoms, but that could be, a viral infection like Lyme's. If you look at the symptomatology of Lyme's disease and compare it to mold, they're pretty much line right up. And on you go, heavy metal toxicity, and then toxins from other parts of our environment. We all look the same, and that's again why autism looks so familiar, and yet it's so different in that the kids are wounded or injured in different ways, but they only have so many different ways to manifest it, so it comes out delayed speech, delayed eye contact, stimming, obsessive compulsive behaviors, anxiety. The job of the physician working with your child is to figure out what the source is so we can kind of fix that. All right, so mycotoxins, mold growth. First of all, mold allergies are different, okay? So my son had mold allergies. He was allergic to mold in a very big way. He actually needed provocation, neutralization, desensitization, kind of like Uber allergy medicine, which is kind of hard to find today because it's pretty labor intensive and kind of expensive for the preparations, but it kind of cures you from mold allergies. What we're going to be talking today is more about mold toxicity, actually the mold spores being in our body and the toxins that come off from it. So mold is a part of the fungi family. It's a fungus, and it loves to grow on anything. It can grow on walls. It can grow on drywall. It can grow under carpets. It grows. It seems like its only requirement, not even light, its only requirement is moisture. And so therefore, to keep things from growing mold, you'd want to keep your humidity down below 45%. And that's kind of hard to do when you're in the south or in many parts of the country. It gets very humid. Also, if you have a leak, a plumbing leak, a roof leak, a sewer leak. I had one family where the sewer ran underneath their house and it erupted, and there was just tons and tons of mold growing underneath the framing of the house, and it made the whole family sick. And they kept saying, "Why can't you make me better?" And I said, "I can't until you move out of that house." And they said their insurance company wasn't helping in that matter, even though it was the city's fault. And it gets very convoluted. If you've ever had any mold issues, you can find, at least until recently, it's been very difficult. Now, when you buy a house, your insurance, your hazard insurance, you should check mold coverage too, because that's an added, kind of like earthquake or whatever. It's flood insurance, hurricane insurance, mold, because then there'll be remediation for that. The symptoms. It's the cold from hell. It doesn't go away. You always have a snotty, runny nose, okay? Just sore throat, of course. Respiratory problems. Now we're talking about like COVID, right? I mean, again, there's only so many ways the body can tell you it's sick. Respiratory problems, shortness of breath. That can be issues too. Muscle aches, headaches also are in there. Body aches, skin hurts, skin crawls, very tender skin. You can have hair loss. There are just so many different symptoms. I even was reading last night cancer. And I don't know quite how that's related, but cancer and autoimmune disease, it can actually trigger autoimmunity. So those are the more common symptoms. You can get rashes, and of course you can get GI issues and reflux disease. I mean, it's almost like you have every disease under the book, and that's going to be really tough to treat. I mean, we'll talk about some approaches in a little bit. You certainly don't want to feed the mold with garbage diets, processed foods. In fact, I had a woman here earlier today. I mean, she just had soup for 2 years. I mean, just fresh broth with fresh vegetables and all, because you want to be very careful not to make things worse. To diagnose it, there are urine tests that you can do. There's certainly blood tests that you can do to find out whether you have yeast in your body or yeast metabolites in your body. And I mean, I'll do that for just typical yeast growing in the gut. But when you look at mold, you can also find the mold metabolites in the urine and the blood too. The house. Boy, there's a lot of controversy. I was kind of reviewing the literature last night about how to actually find mold. And for us, we found it in our HVAC system because we're always running our air conditioner. And we had a really good air conditioner, but the coils got moldy. So the coils had to be taken out and dipped in probably some kind of chlorine solution outside, and then put right back in. And then they put UV lights below and above it to make sure that nothing grows on those coils ever again. And so that's one way you can deal with it. But you can also have mold in the walls, and you can have mold in your vents. So you probably have to have somebody come in and plate the mold spores. In other words, they collect samples and then they try and grow them in the laboratory and tell you if you got black mold, blue mold, white mold, whatever. The color of the mold is just the color of the spores they're producing. Okay, some are more toxic than others, obviously. I mean, we talked about black mold and all, and that's why I always cringed when we go down to hurricane ravaged areas with church youth groups to help tear out moldy stuff, and the kids aren't wearing any protective gear, and I'm like going, that's not a good idea, guys. Not everybody is affected by mold. I read again that 25% of us are not bothered by mold. In fact, when I was a little boy growing up in our house, my job was to put out the pots and the pans when the roof was leaking from rain, because we didn't have money to repair the roof for many years. So I'm sure we had tons of mold because I had lots of pots and pans I had to watch over. And of course you'd hear the tick, tick, tick all night long of the water dropping into the pan. And then of course as it filled with water, you'd hear the drop, drop, drop. I wasn't affected by that. But apparently a lot of people are affected by mold. Mold will smell kind of musty, that basement smell. Many of us have been to homes where it's got kind of a funky odor. Some of us have a better ability to detect that or smell that. My wife certainly does. I can, but she's much better. But she's much better at everything I do, so that's okay. But she really has a sensitive nose to mold, so we can rent her out to check your house to see if you got mold. But anyway, we have special people who come in and they can find wet drywall. They can actually scan behind the walls to see if there's like a pinhole leak. I had one family where in the copper piping behind the toilet there was a pinhole leak that just was an infinitesimally small amount of fluid coming out of it, but day after day, week after week, month after month, it was significant, and the whole bathroom had to be redone because of that. So that's a very common problem with plumbing, with slab leaks, and apparently sewer leaks are more common than I thought as I was reading. Things that run underneath the house that bubble up. So those are the more common sources. The roof leaks, okay, leaks in your plumbing, leaks in the bathroom, okay, and anything below the house if your house is built on a frame and things underneath it go. So making the diagnosis is real important, and then if you're an adult with mold, you probably need to see, and you're suffering with severe depression, anxiety, fibromyalgia, mental fogginess, these symptoms that we talked about, probably need to see an environmental doc who are trained in detoxifying you and helping you in your area pinpoint the source of the mold, because it doesn't really do good if I tell you all that you need to do for you to get you better, but plug you right back into that house that has mold. I can't make you better, or your child better in my case, if we don't fix the sick house. We got to fix the sick house, and then we can fix the sick humans. So when you look at the approach to treating mold, it can get quite extensive, from diets to binders to anti-inflammatories, and they're all important. My problem is when I have somebody who's really sick with mold, when we start giving them things, that makes them even sicker. Charcoal. I mean, I had one woman who you give her charcoal, and it made her sick. I mean, how does charcoal make anybody sick? Anytime we give people who are really mold toxic stuff, they can get sick. So the diet is really important to help desensitize the GI tract from getting sick from charcoal, from bentonite clay, from zeolite plus, so all the binders that we're going to be talking about in a minute or two. And I know you guys are going to have lots of questions. Somebody asked there, hi Rona, is yeast from mold? It's part of the family. It's part of the family of fungi. Okay, so you have this family of fungi, and yeast are part of that. Mold is part of that too, but yeast is not mold, and mold is not yeast. Okay, but you can have mold growing on bread, but you use yeast to make bread. Is that clear? Anyway, I think you get my drift there. Let's see, Janine joined us. Skin rashes, yes, are definitely a part of it. And let's see, Ryan's there, and there's Kelly. Hey, Kelly. Anyway, there's a lot of symptomatology, as you guys are pointing out. Well, I had rashes, or I've seen this, or I've seen that. So then somebody else from, say, a different area who's looking through a different set of lenses, well, that sounds like Lyme's disease. Well, Lyme's has a rash. Lyme causes mental fogging. Lyme causes depression, anxiety. Lyme causes this, this, and this. And then you say, well, maybe they're related, and maybe they have both. And see how complicated it gets, because the human being only has so many ways to show you, so many red lights on the dashboard, and they're all going to light up. They're going to light up if you got Lyme's, and they're going to light up if you've got mold toxicity or some other kind of toxicity. That's what I'm getting to. So the doctor who's working with you has got to be able to figure out all of that, and it might not be so easy. Hey, listen, if you've got mold issues, starting with the diet is very, very important for all of us. In fact, if you've been watching what I do, even with autism, the diet is the basis of survival, getting the junk food out of the diet. And darn if when we're sick we crave the wrong foods, like lots of carbs, like rice and potatoes and stuff. I think that's whatever's growing in us, the fungus that's growing in us is saying, I'm starving here, feed me, and I'll make you crave rice or bananas or something sugary or sweet or processed. But we really need to get down to a very basic diet. Very often the paleo diet is really helpful, and paleo soups are really good. I was reading about garlic and ginger and cayenne pepper all really helping with killing fungus. So that should be part of all of our diets. Anyway, golden seal or the berberine might also be toxic to fungus, which is really good. Omega-3s, vitamin D, artichoke extract have all been shown to be very helpful in decreasing fungal loads, along with colloidal silver, NAC, and alpha-lipoic acid. Again, these are, how many supplements can a person take, especially when they're not feeling well and they've got reflux? So we have to tailor it. It's not, what I'm giving you are things that have been used to help with this, but not anybody can take all of these things, because there's a few more things too. I think low-dose naltrexone can be helpful in throttling the immune system. Quercetin, decreasing our inflammatory response, is always very helpful for allergies, and decreasing the inflammatory response. Taking 2 capsules of charcoal before bed. Again, you would think that's benign, and who couldn't do that? Even I put babies on that. It just makes your stools really black. It's tasteless. It doesn't do anything, but it absorbs toxins as it goes through the digestive tube. But again, I've had people who, they can almost vomit when they take that charcoal. Yeah, that's how sick they are, how sensitive they are to anything in their body. Bentonite clay can help, both taking baths. Saunas are very helpful too, the low infrared saunas. These are all treatments that are designed to help reduce the fungus growing in you. The whole impact of the mold can trigger a mast cell activation. And I know a lot of you study these things, and the mast cell activation again would say that you're going to have a lot of histamine response, so you're going to have a lot of allergies, and that's where vitamin C comes in, magnesium. The B complexes are really important for that. Glutathione transdermally is really effective. I like oral, but that tends to grow yeast, so if you can tolerate oral, that'd be good. IV is another good form of it, and again, the sauna. I was reading an interesting article yesterday by Dr. Klinghardt, who was talking about putting two big things together. I know a lot of you have been hearing about basically electromagnetic radiation, the things that are being, given off by our cell phones, our cell phone towers, EMFs is what they call them, our computers, all of this stuff, the environment, the lights. And they did an interesting experiment. They grew mold shielded from EMFs and basically looked at their spore count, their toxicity. And then they grew mold without the shields. And it seems like these EMFs actually accentuate, accelerate, help mold to grow in a much quicker and faster way. So then the question is, how do we shield ourselves from EMFs? And that's a topic all to itself. That gets in there with, no, I'm not talking about wearing foil caps, David. Okay. But the EMFs can be why we're seeing more of these issues lately in a lot of people where they were these kind of chronic illnesses there weren't that many of them back when I was in medical school in the 80s. Okay, got to remember, we didn't have cell phones back then. We didn't have cell towers. We didn't have computers like we do now. I mean, Apple was just coming out with the Apple computer, the Macintosh, if you guys remember. And this was, all we had was basically a television set. Microwaves were introduced, microwave ovens were introduced in the 70s, in the early 70s. So we were just starting to develop EMFs. The only place that you would really be exposed to EMFs were those high power lines. And usually they didn't build houses anywhere near them. They put cows underneath them. And now we have houses going right up to them, especially where I live here. So EMFs might be the reason why so many people are chronically ill, because they're doing damage themselves, but they're also helping mold to grow. Maybe that's impacting us. So we're seeing a lot of different reasons what's happening in the environment. So let's see here if we got some wonderful questions. And all right, Natalie. Hi, Natalie. Natalie writes, does the stool test that you usually order test for fungus? You might see, what they'll do is they'll usually tell me about yeast, but it doesn't look at mold spores. The urine test that I get from the Great Plains Lab will be more specific about urine and fungus that might be in the body. Okay. Let's see. And let me go up here and see here. Yeast is a form of mold. We talked about that. And skin rashes, yep. Rona asks, are the front loader washers something to be concerned about? You can ask my wife about that. We could not get that mold smell out of there. And then we did everything with the seals and the washing and the cleaning. Water just sitting in that seal just tends to grow mold. So we actually got rid of our front loaders. They did a fair job washing, but it always smelled in our laundry room with mold. And like I said, my family is very sensitive to mold. I'm not, but the rest of them are. So we got rid of our front loaders and got the old-fashioned top loader machines. And again, what we do after we're done washing is my wife keeps the lid open so it has a chance to air out and dry, because mold likes moisture, and as soon as you take away the moisture, it doesn't want to grow and set up shop there. But we've all taken apart, well, I have, the rubber gaskets and stuff, and this slimy black stuff grows. Not good for you. Not good for you. So you got to be kind of careful with that. All right, so let's see, what other questions do we have here? Okay, I think we've answered them all. So that's kind of an interesting topic. Taking care of somebody who's been exposed to mold, especially kids on the spectrum, it's a long, if you've ever had it, it's a long repair process, maybe 2 or 3 years. It's not something that you take 10 days of amoxicillin and you're done. There's a lot of steps between cleaning your house, cleaning your body from the mold. It's a very arduous and long task, kind of like Lyme's. I think I'd rather treat mold than Lyme's. Lyme's is very difficult to work with too, but somehow I wonder, as I was doing all the reading in preparation for this, I wonder if the two are kind of interrelated. I'll have to talk to some Lyme's doctors and ask, because the symptomatology and the triggers and everything are very similar in that. Now the kids show me something different, okay? So the kids, they don't have fibromyalgia. Of course, they all seem to have foggy heads, and they're not really clear with their speech and all. They'll show you something totally different. They don't come in with classic mold. You can't take a history from a child with autism and come up with mold. Every now and then you have to say, we're not getting anywhere. I wonder if this is mold, and you have to run a urine test to actually start taking a look and seeing if that's a problem. But the good news is, by the time we get there, the diet's been cleaned up. We're on our B vitamins, at least from my office. We're on magnesium. We're basically, and you might see that too, a lot of treatments for the immune system, whether your immune system, you're trying to protect it from COVID-19 or protect it from mold. Vitamin C, zinc, vitamin D. In other words, the kids especially who aren't taking in a lot of good healthy foods, the same things to help the immune system react normally. If you have allergies, quercetin, okay? They all seem to work in harmony for a lot that ails you. Food for thought there. Okay, let's go to answer last week's. Can valerian lemon balm be used to replace ADHD meds? Whenever I use a supplement like valerian, I bring it on board first prove that it doesn't do anything bad, because I've had some things actually keep kids awake at night or cause reflux or abdominal pain. It's like, really? With valerian? But yeah, it can cause problems. So I bring on the supplement. I'm asking, can it help with ADD? And it can in some children, not all. Because again, ADD, final common pathway. I can't focus and concentrate. But there's a lot of pathways that can be broken that give you that final result. And the valerian lemon balm may work in one of those pathways, but it doesn't work in the others. And I've talked about it, so those who've been following me have heard this before, my analogy. If I have 4 children out in the front and they're coughing, and one's coughing because they got asthma, and one's coughing because they got a cold, and one's coughing because they inhaled a toy part while it was in their mouth, and one's coughing because they got a sinus infection with postnasal drip, the mom who gets the asthma puffer, albuterol, she says, man, that helped my kids cough. Everybody who has a cough should be on the asthma puffer. Well, that works on kids who are wheezing from asthma, but not the other kids. The same thing here. ADHD is a final common pathway like cough, like autism, but the underlying problems can be different from kid to kid, just like with the cough. So you have to understand that. So to answer your question, I'll bring up the valerian lemon balm, but then if that's working, then I'll slowly lower the ADHD meds to make sure it's working. Sometimes my natural substances don't have the horsepower to get the job done. But remember, ADHD, a lot of it is sugar driven, and I have to remove the sources of sugar. And remember, carbohydrates like rice, french fries, potatoes, that's all converted to sugar in our diets. So we just have to be careful with that. Alrighty. Let's see here. Ryan asks about the pyroluria or pyrrole disorder. So many don't know much about it. Those with autism have it. Some of those, Ryan, have it, not all of them. Okay, so when we talk about autism, there's not a universal. If you have autism, you've got pyroluria or pyrrole disorder. If you have autism, you should look for that. And if it's there, you treat with vitamin B6, and it seems like you know about that. Zinc deficiencies, absolutely. And sometimes you give zinc in the B6. What I tend to do is I measure my zinc levels because, again, you're right. I can give people zinc as a supplement and barely move the needle. So I might have the wrong zinc supplement and I might have to switch. Zincs have different forms, and I like to use zinc picolinate because that one seems to be most easily absorbed by a majority of people, but I have people who can't absorb zinc and you have to use zinc chelate or add it with some vitamins. I'm having, like one child I saw earlier today, iron deficiency, and I'm having a hard time finding the right iron that they can absorb because their body keeps telling me, I'm not absorbing this, I'm not absorbing that. So I have to find either the right iron or the things that go along with the iron to enhance absorption. Alrighty, so Sophia. Hi, Sophia. I have a question. My son, 7 years old with ASD, has very smelly underarms and getting some hairs in his legs and his mustache area. We're waiting for blood results. My husband is not worried, but I am so worried. This is normal for boys age 7. So what you're describing is precocious puberty, where they're going through pubertal changes, where their pores start opening, they start getting some facial hair, they start developing an adult body odor, they can develop pubic hairs, the testicles can start enlarging, the penis can start enlarging. Same thing with the girls, they can start developing the body odor, they'll get some breast bud development. The problem is today my endocrinologists are the doctors who don't do anything. They won't even look. They'll just say, well, you're Hispanic or you're African American. Everybody knows they develop early and it's normal. For a 3rd grader or a 4th grader to be developing, going through sexual changes where their testicles are enlarging, penis is enlarging, pubertal change, that's never normal. But the more often it is, then the doctors, especially the new pediatricians that are freshly minted this year, they're going to think, A, autism is normal. Okay, when I was in medical school, remember autism was 1 in 10,000. When I was in medical school, precocious puberty was 9 or 10 years of age, not 6 or 7, or 5 or 4. In other words, I'll bet you take this child to an endocrinologist, they'll say, well, some kids develop early, and let's look at your heritage. Oh yeah, your group of people always develop early, everybody knows that. And next thing you know is you have a 4th grader who's got a menstrual cycle. What's with that? And they call that normal. Okay. Again, from my generation, girls didn't start developing until middle school. And middle school didn't start in 6th grade. Middle school started in 7th grade. So we're seeing changes, and then there's lots of people out there talking about the plastics are causing the changes and they call the foreign hormones that are entering our bodies. They call them they enter our bodies, whether they've been through milk or whatever, is causing problems. But the blood work that you're waiting for should have looked at the puberty hormones. And basically I look at total estrogens, and I look at the male hormones, androstenedione, and I look at testosterone and free testosterone. Then I look at DHEA, DHEAS. I'll look at prolactin. And so I have a little panel that I like to get. I would say that in my practice, especially with children on the autism spectrum, that is not uncommon. That's not uncommon. And it needs to be treated. You can't just let it roll. So what you're talking about here. Now, it's not so much something to worry about. I don't operate from a position of worry. I operate from a position, let's figure out what this is and fix it. Okay, because worrying doesn't fix anything. Okay, I think you identified a problem, and the blood work should be done appropriately, interpreted appropriately, and then if indicated, a treatment protocol should be initiated and shut it down. Okay, so that's how I would approach that. So you'll probably be able to write back next week and tell me what those blood results were, and I can tell you what I would do in my clinic if I had a child present with those blood works. I can't tell you what you to do. Okay. Very cool. All right, let's see if we got any more questions before we wrap up today's show. Oh, there's a lot of talk in here. I take over 96 zinc pink. Okay, that's Ryan. Inositol, methionine. Okay, good, good, good. All right. So, no other questions. We could probably do, and you've probably seen this, days worth of talks on mold, on exposure, on trying to figure out what it is. I try to give you kind of a broad picture of how we look at it, but there are textbooks written on mold toxicity, and mold treatment. And they're probably more from the environmental side, environmental medical doctors, because it's in our environment and that's what they specialize in best. But it's almost a whole field unto itself, kind of like autism, Lyme's, treating mold. It's rapidly evolving, and people are getting better and better at it. So I think if you do have mold exposure and mold issues, the best thing to do would be to seek out a mold literate doctor. And that means somebody who just specializes it, and they may be bringing in homeopathic remedies as well as naturopathic remedies, and if indicated, even my allopathic medications too. So sometimes a harmony of them all works best instead of just one group or another. But the bottom line is you need to see improvement. That's how I look at it too. Okay, so we are done with today's show on mold. Fascinating, interesting, and even scary as far as diseases go. This isn't a diaper rash. This isn't an ear infection. This isn't even a pneumonia or a skin wound. This is a chronic illness that's very debilitating, and it takes a while to treat. But there's a lot of good treatments that are very effective and pretty curable if you hang to it. All right, so guys, have a great week. Be safe and sane out there. It's just getting nuttier and nuttier for a little while longer, right? And look forward to being here again next week with a very interesting topic, which I'm not going to tell you yet because it's a secret. We'll talk to you later. Bye-bye.